So this video is going to go over improvised bleeding control for severe life-threatening external bleeding, veins, arteries where it's pouring or spurting out of a patient, when you have zero first aid equipment. So I have nothing, not even gloves. Gloves, again, would be ideal for my personal protection, but if I feel comfortable providing this care to the patient, then this is going to be a life-saving intervention. So even without a first aid kit, I can provide some help to this patient by just using basic things I find around. So things that I'm looking for are clothing. So you could use like t-shirts, towels, bits of cloth, like torn up bits of clothing. Any of that's going to work well. And then if we're trying to make an improvised tourniquet, we just need something that we can create a windlass with that's not going to snap. So you can think tools, cutlery, markers, something that when you apply that force, it's not going to be significant enough to break it. So anything you've got around that's going to help. Our first kind of control of severe external bleeding is to find where the bleeding is. So it may be obvious where you already have a cut to the clothing, you can see a pool of blood around the area. If so, try to extend that and see exactly where the bleeding is coming out of. That's where you really want to focus your efforts on the pressure. Okay, so we're going to get some cloth, and if it's a deep wound, you're going to try to shove it into the wound, and then what you want to do is get that all bunched up on top and just hold really good firm pressure for at least 5 minutes. So we're just going to kind of lean over the patient just like we were doing CPR, and really hold our hands firmly on there, pushing our hands into that wound, into that bleeding, and using the ground as our kind of counter force. So we're just going to hold here for 5 minutes, call 911 EMS, have them on the way, and then this is our best way to control it. If there's not blood still pouring and pooling around, we know we've got a good spot. If this isn't really doing anything to control the bleeding, maybe you're in the wrong spot. Move up a little bit, pack it a little bit deeper, and see if that's providing you better pressure. Okay, you really want to get that right spot to really control that pressure. Once you've held this on for a good 5 minutes, you could consider tying this on and securing it. So we've got another shirt here, a nice long sleeve shirt. So what we can do is while we're trying to get it ready, you can use your knee just to hold that pressure. I'm going to try to get my shirt, or it could be a jacket, roll it up to make a nice long piece. Then we're going to take that, place it over top of the bleeding, and wrap it around. Okay, we want to pull this in nice and snug, and we're going to tie our knot directly on top of where the bleeding is. So we're going to try to get everything nice and centered here, really get a good pull, and double knot that off. And again, we want to reassess to see if this works. So again, we'll check, is there still blood pooling around? Is it holding pretty well? Are we seeing a lot of blood coming out? If we are, this isn't super functional. Once we've got something tied on, we don't really want to remove this because it's probably doing something towards clotting and controlling it. You can add manual pressure back on top of this if needed. And if this still isn't really helping, we can add an improvised tourniquet. So to do an improvised tourniquet, we just need a long piece of cloth. So again, you could use a shirt. You want it reasonably wide, and you want to go about a hand above the bleeding. So we're just going to take this. We're going to tie it about a hand above the bleeding. And we're going to tie a big knot in it. Okay, we're going to take what we can find to use as our windlass. So I happen to have a butter knife here, so we'll use that. And we're going to tie that in here. And then what we want to do is we're going to turn this and try to create that force for that bleeding to be controlled. Okay, once you've got the bleeding controlled, or you've spun it as much as you can, you need to secure this off. So you can grab another piece of clothing. I've got another cloth here. I'm just going to wrap this around the end of that fork, and then I'm going to bring it around the back, and I'm going to use this to tie it off. And this will help to keep that windlass, which is the fork piece, from coming unwound. Okay, if this still hasn't functioned, we could even tie another improvised tourniquet above this one to add more bleeding control. And again, go back to that firm, directed pressure and hold that till EMS arrives. And that's our control of the severe external bleeding patient.